all seen the pink ribbon throughout the year, but what does it really mean?
Today we'll be talking about breast cancer, the history of breast cancer, who is affected by it, and symptoms, and much more. So, what is breast cancer? Breast cancer is a disease where cells in the breast grow out of control and it can be developed in any cell located in the breast. Just like any other cancer disease, it can spread out to the other parts of the body. The two most common forms of breast cancer are invasive lobular carcinoma, where the cancer cell begins in the lobule part of the breast and then spreads to the nearby breast tissues, and invasive ductal carcinoma, where the cancer cells begin in the duct part of the breast and then grow to the other parts of the breast tissue. There are also less common forms of breast cancer. There are Paget's disease, inflammatory breast cancer, mucinous, and medullary. Paget's disease, where the breast cancer cells begin in the nipple and spread to the dark areas of the skin. Medullary, where cancer cells begin in the milk ducts and spread to the tissue near the ducts. Mucinous, where cancer cells begin in the milk ducts and spread to the tissue near the ducts. Inflammatory breast cancer, cancer cells block lymph vessels in the skin of the breast. History of breast cancer. A papyrus was discovered in Egypt that contained medical/surgical records of many injuries and cases of tumors found in the breast around 1500 to 1600 BC. It was treated by destroying the tissue using a hot instrument called the fire drill. In ancient Greece, Hippocrates described the stages of cancer in 400 BCE, and they were called the wandering womb. Hippocrates also thought that there were 4 body fluids: blood, phlegm, yellow bile, and black bile, and having too much black bile in a body would cause cancer. Throughout the 1600s and 1900s, scientists and doctors have been researching human anatomy, the causes of cancer, how cancer spread, and lymphatic system. All of that led to understanding cancers like breast cancer and developing treatments for breast cancer.
People who are infected by breast cancer are most likely to be the women of age 55 and older, but the risk can increase as you do get older. White women are at a higher risk of getting breast cancer at 128 per 100,000 females in all other ethnicities, but black women are most likely to get an aggressive and advanced stage at 121 per 100,000 females. Black women have a higher chance of dying as well. This outcome comes from inadequate medical care, less access to mammography, and even your lifestyle patterns such as eating habits, smoking, drinking, weight issues, etc. Asians and Pacific Islander men and women have a lower chance of breast cancer because their race has the highest liver and stomach cancer rates. Sometimes breast cancer has little to no obvious symptoms at all. It's always important to keep an eye on your breast and to check on it every now and then. Breast cancer symptoms are skin irritation or dimpling, breast and nipple pain, nipple discharge, a new lump in the underarm area, red or thickening of the nipple or breast skin, swelling of all or parts of the breast, and more. This photo demonstrates the possible symptoms that can happen to you. These occur when the breast cells begin to grow abnormally. The cells rapidly divide than healthy cells, causing the symptoms of a formed lump. These can be from other conditions such as an infection or a cyst. It's always best to consult with the doctor first.
How does breast cancer affect the body? Breast cancer can affect your body by causing skin irritation near the breast pain, swelling, a new lump mass in breast, thickening of skin, underarm swelling and pain, changes in breast color, dry breast tissue, nipple discharge, fatigue, nipple retraction, and loss of appetite. Not all of those symptoms would be present when someone has breast cancer, but having most of them can indicate that you have a problem and you should contact your doctor. Breast cancer doesn't only stay in the breast, it can also spread to other parts of your body. Some organs the cancer can spread to are your liver, brain, muscle, lungs, and bones. Is there a cure for breast cancer or any treatments? There are no natural cures for breast cancer, but there are treatments you can take if you suffer from breast cancer. Not all of the treatments can be used for every type of breast cancer because the treatments depend on how much the cancer spread and the type of breast cancer. Some breast cancer treatments are surgery, chemotherapy, hormonal therapy, biological therapy, radiation therapy, targeted therapy. There are also some medical treatments that help ease the effects of the breast cancer and cancer treatments.
types of help and therapy that you can get to help with your breast cancer. There are things patients can do and what to avoid, specifically food. They can't consume any alcohol, spicy, crunchy, or acidic food, bread, and processed meat.
The number of people affected by this disease. In 2019 America, there have been 863,830 reports among women on new breast cancer cases and 263,722 deaths from breast cancer. From every 100,000 people, 415 new cancer cases were reported and 126 deaths from breast cancer. In 2020, there have been 2.3 million reported cases of breast cancer worldwide and 665,000 deaths. In 2022, there have been more than 3.8 million women that has a history with breast cancer. Those are women who are still taking treatment and who are already finished with their treatment. Estimates of possible breast cancer cases this year: 287,850 new cases of invasive breast cancer and 51,400 new cases of non-invasive breast cancer.